1. Which of the following best defines mental health? A. The absence of mental illness. B. The ability to manage stress, relate to others, and make healthy decisions. C. A constant state of happiness. D. Compliance with medical treatments. 2. The term psychosis refers to A. A mild form of depression. B. A state where reality is distorted. C. A type of anxiety. D. A personality trait. 3. Which of the following is an example of a hallucination? A. Believing others are out to harm you. B. Hearing voices that are not present. C. Feeling guilty about past actions. D. Being forgetful. 4. A person with bipolar disorder may exhibit A. Constant sadness. B. Alternating periods of depression and mania. C. Fear of crowds. D. Disorganized speech. 5. Anxiety disorders are primarily characterized by A. Delusions. B. Excessive worry or fear. C. Mood swings. D. Memory loss. 6. Delusions are defined as A. Involuntary movements. B. False beliefs strongly held despite evidence. C. Repeated thoughts. D. Unexplained fatigue. 7. A patient who refuses to leave their room due to fear of open spaces may suffer from A. Claustrophobia. B. Paranoia. C. Agoraphobia. D. Obsessive-compulsive disorder. 8. Which mental health condition is most commonly associated with flashbacks and nightmares? A. Panic disorder. B. Schizophrenia. C. PTSD. D. ADHD. 9. A mental health emergency requiring immediate attention would include A. Refusing food. B. Inability to sleep. C. Suicidal ideation. D. Forgetting appointments. 10. Mental health stigma can lead to A. Increased access to care. B. Improved recovery outcomes. C. Social isolation and lack of treatment. D. Better medication adherence. 11. A CNA should report to the nurse immediately if a resident A. Refuses to take a shower. B. Complains of loneliness. C. Talks about wanting to die. D. Stays up late. 12. A person diagnosed with schizophrenia is most likely to exhibit A. Excessive happiness. B. Disorganized thinking and hallucinations. C. Anxiety about social situations. D. Obsessions and compulsions. 13. Which of the following is not a common symptom of depression? A. Loss of interest in activities. B. Increased energy. C. Sleep disturbances. D. Feelings of worthlessness. 14. Which neurotransmitter is most associated with mood regulation? A. Acetylcholine. B. Insulin. C. Serotonin. D. Dopamine. 15. What is the purpose of a psychiatric care plan? A. To restrict the patient's behavior. B. To enforce medication compliance. C. To guide care based on the patient's specific needs. D. To allow the CNA to act independently. 16. Which of the following would be most appropriate when interacting with a resident with paranoia? A. Speak loudly and quickly. B. argue about their delusions. C. Approach calmly and explain actions. D. Touch them to reassure. 17. Which of the following is a sign of mental health relapse? A. Following the care routine. B. Asking for help. C. Withdrawing from others. D. Eating meals regularly. 18. The term dual diagnosis refers to A. A physical and mental illness occurring together. B. Two personality disorders. C. Depression and anxiety. D. Mania and schizophrenia. 19. Suicide risk increases significantly when A. The individual starts to show signs of recovery. B. The individual avoids medication. C. There is a history of attempts. D. The person complains of boredom. 20. When caring for a patient with dementia, a common behavior the CNA may observe is A. Hallucinations. B. Flight of ideas. C. Logical reasoning. D. Compulsive lying. 21. The most therapeutic response from a CNA to a resident who is crying is A. You'll feel better tomorrow. B. Stop crying, it will upset others. C. Would you like to talk about what's upsetting you? D. Try to distract yourself with TV. 22. Active listening includes all the following except A. Maintaining eye contact. B. Interrupting when the patient pauses. C. Nodding in acknowledgement. D. Reflecting feelings. 23. When communicating with a nonverbal psychiatric patient, a CNA should A. Ignore them and focus on verbal resonance. B. Assume their needs based on routine. C. Use pictures or gestures. D. Ask others to interpret for them. 24. Which of the following is a non-therapeutic communication technique? A. Restating. B. Reflecting. C. Giving advice. D. Using silence. 25. The primary purpose of using open-ended questions is to A. End the conversation quickly. B. Gather yes-no answers. C. Encourage elaboration. D. Avoid emotional topics. 26. You mentioned feeling hopeless. Can you tell me more about that? Is an example of A. Confrontation. B. Validation. C. Active listening. D. Leading question. 27. Which is the best approach when speaking to someone experiencing auditory hallucinations? A. Agree with the hallucination. B. Speak louder than the voices. C. Remind them that you do not hear the voices. D. Ignore their concern. 28. Effective communication with patients in crisis involves A. Confrontation. B. Clear, calm, simple language. C. Long explanations. D. Rapid-fire questioning. 29. A CNA should use touch cautiously in mental health settings because A. It may be misinterpreted. B. It's always encouraged. C. It reduces boundaries. D. It can trigger psychosis. 30. Reflective listening helps. A. The CNA give advice. B. The patient feel heard and understood. C. The patient suppress feelings. D. The CNA maintain control. 31. The best way to redirect a disoriented patient is A. Argue until they accept reality. B. Ignore their behavior. C. Gently guide conversation and attention elsewhere. D. Use restraints. 32. A patient begins to yell and insult others during lunch. The CNA should A. Yell back to regain control. B. Remove other patients. C. Calmly speak and redirect behavior. D. Punish the patient. 33. Which phrase shows empathy? A. I know how you feel. B. I can imagine this is hard for you. C. Don't feel that way. D. This isn't a big deal. 34. The validation technique involves A. Correcting errors in thinking. B. Reinforcing delusions. C. Acknowledging feelings without judgment. D. Enforcing medication use. 35. When a patient confides suicidal thoughts, the CNA should A. Keep it confidential. B. Leave the room and call 911. C. Stay with the patient and notify the nurse immediately. D. Tell them they'll feel better soon. 36. A good way to build rapport with psychiatric patients is to A. Avoid discussing emotions. B. Always joke to lighten the mood. C. Be consistent, respectful, and non-judgmental. D. Tell them your personal problems. 37. When a resident with schizophrenia talks about voices telling them to leave, the CNA should A. Argue that it's not real. B. Validate their experience and ensure safety. C. Laugh and say that's just your imagination. D. Let them wander outside. 38. Offering choices during care promotes A. Disobedience. B. Delusion. C. Empowerment and cooperation. D. Confusion. 39. Which behavior reflects boundary violation? A. Accepting a small thank you card. B. Sharing your personal phone number. C. Listening without judgment. D. Reporting concerns to the nurse. 40. A patient becomes withdrawn and avoids eye contact. The CNA should A. Force them to engage. B. Respect their space and gently encourage interaction. C. Ignore them. D. Involve other residents to pressure them. 41. Patient confidentiality must be maintained. A. Unless the patient is famous. B. At all times, unless there is danger to self or others. C. Only in front of family. D. Only during medication times. 42. Which of the following is considered abuse? A. Forgetting a meal. B. Encouraging exercise. C. Yelling at a patient in distress. D. Taking vital signs. 43. Informed consent requires that the patient A. Obeys orders. B. Understands the procedure and agrees voluntarily. C. Is sedated. D. Signs a blank form. 44. Neglect can include A. Skipping a scheduled bath. B. Engaging in conversation. C. Offering a choice of food. D. Cleaning the room. 45. The Health Insurance Portability and Accountability Act HIPAA protects A. CNA certification. B. Facility equipment. C. Patient privacy and health information. D. Doctor credentials. 46. If a CNA witnesses abuse, they should A. Wait for confirmation. B. Report it to the nurse immediately. C. Pretend not to see. D. Ask other CNAs first. 47. Restraining a patient without proper documentation or order is A. Encouraged in emergencies. B. Acceptable if they are allowed. C. A violation of rights. D. Permitted by CNAs. 48. Which is not a patient right? A. Freedom from abuse. B. Confidentiality. C. Denial of medication without consent. D. The right to participate in care decisions. 49. Assault is defined as A. Physical harm only. B. A threat or attempt to harm. C. Medical advice. D. Accidental touching. 50. If a patient refuses care, the CNA should A. Force the procedure. B. Document and report the refusal. C. Ignore the behavior. D. Punish them. 51. What is the most important reason to document patient behavior accurately? A. To create extra work. B. For insurance reimbursement. C. For legal protection and care planning. D. To impress the supervisor. 52. Which of the following must be reported immediately? A. Skipping a meal. B. Talking to self. C. Threats of harm to others. D. Refusal of television. 53. Battery is defined as A. Verbal abuse. B. Unlawful physical contact. C. Emotional neglect. D. Offering medication. 54. A CNA finds a patient crying and says nothing, continuing care. This could be A. Therapeutic silence. B. Neglect. C. Appropriate care. D. Encouraging compliance. 55. CNAs are legally required to A. Give injections. B. Diagnose patients. C. Report suspected abuse. D. Change medications. 56. A patient asks to review their care plan. The CNA should A. Say it's not your business. B. Say you need a doctor for that. C. Report to the nurse for guidance. D. Hide the document. 57. Which ethical principle involves acting in the patient's best interest? A. Autonomy. B. Beneficence. C. Justice. D. Fidelity. 58. Which action violates patient autonomy? A. Offering options. B. Encouraging independence. C. Making decisions without input. D. Respecting choices. 59. Who is responsible for assigning tasks to a CNA? A. Another CNA. B. Family members. C. Supervising nurse. D. The patient. 60. If a CNA is unsure whether a task is allowed, they should A. Try anyway. B. Ask a coworker. C. Consult the supervising nurse. D. Look it up online. 61. A patient is pacing, clenching fists, and appears angry. The CNA should A. Yell to assert authority. B. Leave the patient unsupervised. C. Speak calmly and maintain a safe distance. D. Restrain the patient immediately. 62. A mental health emergency should be reported. A. Only if it's life-threatening. B. During the next shift. C. Immediately to the nurse. D. In the weekly staff meeting. 63. The first step in crisis de-escalation is A. Physical restraint. B. Offering choices and listening. C. Isolating the patient. D. Administering medication. 64. When a patient becomes violent, the CNA should A. Run away. B. Confront them. C. Prioritize personal and others' safety. D. Lock the door. 65. If a patient expresses suicidal thoughts, the CNA must A. Ignore it to avoid encouraging the idea. B. Tell them others have it worse. C. Stay and notify the nurse immediately. D. Ask for a detailed suicide plan. 66. One of the best methods for preventing aggressive outbursts is A. Ignoring early warning signs. B. Encouraging open expression of feelings. C. Enforcing silence. D. Limiting activity. 67. Which environment promotes safety in psychiatric care? A. Cluttered rooms with bright lights. B. Quiet, structured, and predictable routines. C. Loud announcements. D. Infrequent staff contact. 68. When a CNA observes escalating behavior, they should A. Attempt to restrain the patient. B. Provide space and use de-escalation skills. C. Argue and debate. D. Dismiss the behavior as attention-seeking. 69. Elopement risk refers to A. Inability to follow commands. B. Refusal to take medication. C. Patient attempting to leave the facility unsafely. D. Use of restraints. 70. The best time to prepare for a psychiatric crisis is A. After it happens. B. During admission. C. Only during staff meetings. D. Never, it's unpredictable. 71. A patient with a history of aggression should be placed A. In an isolated area. B. In a supervised, low-stimulation setting. C. Near exits. D. Without safety precautions. 72. Which behavior suggests the need for immediate safety intervention? A. Pacing and silence. B. Smiling and cooperation. C. Verbal threats and clenched fists. D. Reading quietly. 73. A patient slams a chair during group therapy. The CNA should A. Ignore it. B. Yell at them. C. Calmly redirect and notify the nurse. D. Laugh to defuse tension. 74. When documenting a crisis, the CNA must include A. Only patient quotes. B. Personal feelings. C. Objective facts, behaviors, and time. D. Nurses' opinions. 75. The least restrictive intervention should be used A. When convenient. B. As a first choice. C. Only after physical restraint. D. Never. 76. Which patient is at highest risk of suicide? A. Elderly woman with family nearby. B. Teen recently released from psychiatric care who expresses hopelessness. C. Middle-aged man attending therapy. D. Young adult starting college. 77. A CNA notices missing sharps in a psychiatric unit. The best response is A. Assume it's a mistake. B. Search the patient's rooms. C. Report immediately to the nurse. D. Replace the items quietly. 78. Which object should not be allowed in a high-risk psychiatric unit? A. Soft blanket. B. Spiral notebook. C. Metal fork. D. Crayons. 79. When restraining is ordered, a CNA should A. Apply it alone. B. Use it before all other options. C. Assist according to policy and with supervision. D. Leave after application. 80. If a patient is having a panic attack, the CNA should A. Tell them to stop. B. Ignore it. C. Stay calm, offer reassurance, and encourage slow breathing. D. Call security. 81. A common feature of obsessive-compulsive disorder is A. Delusions of grandeur. B. Hallucinations. C. Repetitive thoughts and behaviors. D. Paranoia. 82. Which disorder is most associated with mood swings between mania and depression? A. Schizoaffective disorder. B. Major depressive disorder. C. Bipolar disorder. D. Generalized anxiety disorder. 83. Which medication is commonly prescribed for schizophrenia? A. Lithium. B. Haloperidol. C. Ativan. D. Sertraline. 84. Which mental health condition may involve compulsive hand washing? A. PTSD. B. OCD. C. Schizophrenia. D. Panic disorder. 85. Depression is often treated with A. Antihistamines. B. Antipsychotics. C. Antidepressants and therapy. D. Surgery. 86. A patient experiencing hallucinations may A. Wash hands repeatedly. B. Avoid eating. C. Hear voices others do not. D. Fear public speaking. 87. Which of the following is a sign of mania? A. Slow speech. B. Low energy. C. Elevated mood and rapid talking. D. Suicidal thoughts. 88. Generalized anxiety disorder includes A. Severe memory loss. B. Hallucinations. C. Excessive worry. D. Violence. 89. PTSD symptoms include A. Constant elation. B. Repeated trauma flashbacks. C. Forgetfulness only. D. Avoidance of eating. 90. ADHD is typically characterized by A. Excessive aggression. B. Impulsivity and inattention. C. Hallucinations. D. Low mood. 91. Which class of medications can cause drowsiness and must be monitored? A. Antibiotics. B. Antipsychotics. C. Decongestants. D. Laxatives. 92. A CNA should monitor patients on psychiatric medications for A. Hyperactivity. B. Side effects and unusual behavior. C. Intelligence. D. Cleanliness. 93. A patient taking lithium needs monitoring for A. Liver damage. B. Infection. C. Toxicity symptoms like tremor or confusion. D. Heart rate. 94. The primary goal of psychotherapy is to A. Sedate patients. B. Promote emotional healing and behavior change. C. Replace medication. D. Provide restraints. 95. Electroconvulsive therapy (ECT) may be used to treat A. Mild stress. B. Drug withdrawal. C. Severe depression. D. ADHD. 96. Substance use disorders involve A. Occasional drinking. B. Using medication as prescribed. C. Compulsive substance use despite harm. D. Food allergies. 97. A dual diagnosis patient has A. 2 mental illnesses. B. A mental illness and intellectual disability. C. A psychiatric and substance use disorder. D. A medical and dental issue. 98. If a patient refuses psychiatric medication, the CNA should A. Force them to take it. B. Report refusal to the nurse. C. Hide it in food. D. Argue. 99. Schizoaffective disorder combines symptoms of A. Depression and phobia. B. Schizophrenia and mood disorder. C. Anxiety and delusion. D. Autism and hallucination. 100. Borderline personality disorder is marked by A. Disorganized thought. B. Stable self-image. C. Intense emotional instability and fear of abandonment. D. Joyful mood swings. 101. Which of the following is a patient right in a mental health facility? A. To be restrained without cause. B. To refuse treatment. C. To be isolated permanently. D. To be denied visitors. 102. Informed consent means the patient A. Must obey all orders. B. Understands and agrees to treatment. C. Signs all papers without reading. D. Is sedated before treatment. 103. The CNA should report any suspicion of abuse. A. Only if the patient asks. B. Immediately to the nurse or supervisor. C. Next week. D. After talking to the suspected abuser. 104. Patients with mental illness have the right to A. Be denied meals. B. Live free from discrimination. C. Be punished for behavior. D. Refuse personal hygiene. 105. Confidentiality in mental health care means A. Discussing patients in public. B. Sharing all details with everyone on staff. C. Only authorized individuals can access patient info. D. Posting updates online. 106. If a patient requests to see their medical records, the CNA should A. Grant access immediately. B. Refuse and hide the file. C. Refer the request to the nurse. D. Make copies. 107. Advocacy by a CNA includes A. Making treatment decisions. B. Encouraging patients to follow rules. C. Supporting patient rights and needs. D. Ignoring complaints. 108. A patient complains of unfair treatment. The CNA should A. Punish them. B. Report the concern to the nurse. C. Laugh. D. Tell them to be quiet. 109. A psychiatric patient refusing medication is A. Illegal. B. A sign of poor character. C. Exercising their legal right. D. A reason for discharge. 110. The CNA notices a staff member yelling at a patient. The CNA should A. Join in. B. Report the behavior immediately. C. Pretend not to hear. D. Wait for the next shift. 111. An example of neglect is A. Providing too much care. B. Withholding food or hygiene support. C. Giving extra blankets. D. Offering emotional support. 112. HIPAA laws exist to A. Punish healthcare workers. B. Protect patient privacy. C. Limit access to treatment. D. Control staff behavior. 113. Who can access a patient's mental health records? A. The public. B. Only family. C. Authorized healthcare team members. D. Other patients. 114. When documenting, CNAs must A. Be vague to avoid mistakes. B. Use humor. C. Use objective, factual language. D. Add personal opinions. 115. A patient threatens to harm others. The CNA should A. Keep it a secret. B. Tell another patient. C. Alert the nurse immediately. D. Walk away. 116. Cultural rights in mental health include A. Forcing all patients to speak English. B. Allowing disrespect of beliefs. C. Respecting individual traditions and practices. D. Banning religious symbols. 117. If a patient refuses a meal, the CNA should A. Force feed. B. Ignore them. C. Respect the choice and report to the nurse. D. Threaten punishment. 118. Mental health patients in long-term care have the same rights as A. Prisoners. B. Children. C. Any other healthcare resident. D. Military personnel. 119. The best way to empower a psychiatric patient is to A. Ignore their choices. B. Support their independence and decision-making. C. Set strict rules. D. Control their schedule. 120. Advanced directives in mental health care include A. Plans for meals. B. Legal instructions for future treatment decisions. C. CNA work hours. D. Dress codes. 121. A primary role of a psychiatric CNA is to A. Diagnose illness. B. Provide supportive, basic care. C. Prescribe medications. D. Design treatment plans. 122. When observing a behavioral change, the CNA should A. Ignore it. B. Assume the patient is faking. C. Document and report it. D. Discipline the patient. 123. The CNA's duty includes A. Counseling. B. Monitoring safety and hygiene. C. Diagnosing disorders. D. Administering injections. 124. The CNA should always maintain A. A power dynamic. B. Therapeutic boundaries. C. Close personal friendships. D. Physical distance only. 125. When assisting a patient with delusions, the CNA should A. Argue about the delusion. B. Validate feelings without supporting false beliefs. C. Encourage the delusion. D. Ignore them completely. 126. Mental health CNAs must demonstrate A. Indifference. B. Clinical detachment. C. Compassion and patience. D. Complete control. 127. A good response to a patient saying "I feel worthless" is A. Stop thinking like that. B. That's not true, you are important. C. Go to bed. D. Let me call your family. 128. If a patient is nonverbal, the CNA should A. Assume they don't need care. B. Ignore them. C. Use nonverbal communication and report behavior. D. Avoid the room. 129. If a CNA feels overwhelmed, they should A. Quit. B. Report stress and seek support. C. Blame the patient. D. Take it out on staff. 130. During group therapy, the CNA's role is to A. Lead the session. B. Observe and ensure safety. C. Diagnose participants. D. Take attendance. 131. Documentation by a CNA should include A. Behavior, hygiene, mood. B. Diagnosis. C. Only medical data. D. Daily gossip. 132. A CNA should refer questions about medication to A. Another patient. B. The patient's family. C. The nurse. D. The internet. 133. If a patient becomes sexually inappropriate, the CNA should A. Ignore it. B. Encourage expression. C. Set clear boundaries and report. D. Flirt back. 134. Cultural humility for CNAs means A. Avoiding cultural topics. B. Respecting and learning from different backgrounds. C. Making all patients act the same. D. Preferring one group over others. 135. CNAs help patients gain independence by A. Doing everything for them. B. Encouraging self-care and participation. C. Restricting choices. D. Creating dependency. 136. The CNA should change gloves. A. Once a day. B. After each patient contact. C. Only when dirty. D. Only if another staff tells them to. 137. Appropriate CNA response to hallucinations. A. You're crazy. B. Those voices aren't real, ignore them. C. I don't hear them, but I know it feels real to you. D. I hear them too. 138. To build trust with a psychiatric patient, the CNA should A. Share personal problems. B. Be consistent, respectful, and reliable. C. Tell them what to do constantly. D. Joke about their condition. 139. Which skill is essential for mental health CNAs? A. Physical strength. B. Sarcasm. C. Active listening. D. Argumentation. 140. A psychiatric CNA works under the supervision of A. No one. B. The patient. C. A licensed nurse. D. Other CNAs. 141. Cultural sensitivity means the CNA should A. Assume all patients are the same. B. Treat everyone exactly like themselves. C. Respect and adapt to cultural differences. D. Avoid asking about culture. 142. A trauma-informed approach includes A. Ignoring past trauma. B. Creating a safe, empowering environment. C. Forcing patients to talk. D. Focusing only on behavior. 143. When unsure of a patient's cultural practice, the CNA should A. Avoid the topic. B. Ask respectfully. C. Make assumptions. D. Rely on stereotypes. 144. A trauma-informed CNA avoids A. Patient triggers. B. Empathy. C. Listening. D. Emotional support. 145. A patient flinching when touched may be experiencing A. Joy. B. Trauma response. C. Sleepiness. D. Hallucination. 146. In trauma-informed care, the emphasis is on A. Control. B. Compliance. C. Choice, safety, and collaboration. D. Punishment. 147. Patients from different cultures may express mental illness A. In identical ways. B. Only through speech. C. Differently, including physical symptoms. D. By hiding entirely. 148. If a cultural or religious practice seems unusual, the CNA should A. Correct the patient. B. Make jokes about it. C. Respect and accommodate it if safe. D. Report it as a threat. 149. Which of the following reflects trauma-informed care? A. You need to calm down. B. What's wrong with you? C. What happened to you? D. That's just in your head. 150. A culturally sensitive CNA will A. Ask others to explain the patient's behavior. B. Make judgments based on appearance. C. Use the patient's preferred name and language. D. Only speak English. Psychiatric CNA Mental Health CNA. The Psychiatric CNA Mental Health CNA test is a specialized examination designed to assess the knowledge and skills of certified nursing assistants who work with patients experiencing mental health disorders. This test evaluates the CNA's ability to provide compassionate, safe, and effective care in psychiatric or behavioral health settings. It covers areas such as communication techniques, patient rights, mental illness symptoms, safety and crisis intervention, therapeutic boundaries, and trauma-informed care. CNAs must demonstrate understanding of psychiatric conditions, appropriate interventions, and cultural sensitivity. The test ensures CNAs are prepared to support patients' mental, emotional, and physical well-being in a respectful and professional manner. Here are the top 5 beneficial uses of the sample exam. 1. Validates competency. The test ensures that CNAs possess the essential knowledge and skills to safely care for patients with mental health conditions, helping maintain high standards in psychiatric settings. 2. Improves patient outcomes. Certified CNAs are better equipped to handle behavioral issues, promote emotional stability, and contribute to improved mental health outcomes. 3. Supports career advancement. Passing the exam opens opportunities for CNAs to work in specialized psychiatric units, secure higher-paying roles, and gain professional recognition. 4. Promotes safety. It prepares CNAs to effectively manage crisis situations, prevent self-harm, and ensure a safe environment for both patients and staff. 5. Enhances communication. The test reinforces therapeutic communication techniques, allowing CNAs to build trust, reduce patient anxiety, and support recovery.